Harry.
Hi everybody, I'm going to talk today about the CUB support and how you as a healthcare professional, either a midwife or a labour and delivery nurse or a doctor, would look after somebody while using the CUB, whether they've brought one in that's their own or whether you happen to have them in your facility. So firstly, what is it? Really, it's a kind of hybrid between a birth ball and a birth stool, but it's much more versatile than that. For example, the birth ball, and I have a handy one here, it's really great for people to use in early labour. It helps them remain upright. However, the big disadvantages are that once labour really becomes established, it becomes much more difficult to use, and the person using it has to be able to balance, use their legs. The other problem with it is they're very difficult to keep clean. Now, some people do have covers for them, and that's absolutely fine. The other negative about them is that they are not biocompatible. They were never designed for use in healthcare, never mind for mothers having babies. They are inexpensive and very flexible because they use a lot of very cheap plasticizers in them that makes them more flexible. So they're not ideal to be used against somebody's skin for extended periods of time either. The other very obvious thing, although people call them a birth ball, nobody can give birth sitting in a ball. It just doesn't happen. So they have their limitations and they have their uses. So the CUB has the advantages of a birth ball in as much as it's inflatable and it's comfortable to be on, and you can sit on it in early labour. However, the difference is the CUB has a biocompatible coating on it that's specially designed for use in healthcare. It is a registered medical device, so it does have its advantages in that way. The other aspect about the CUB is that it has a very unique shape to it, and this was designed really to give the advantages, if somebody wanted to, of using it as a birth stool. So you can use it in a double inflation. There's two separate inflation chambers here. The inflation valves are at the back. But ideally, using it in a double inflation like this in early labour is great. It has the advantages of comfort and upright positions that a birth ball would have, except the person using it can use it for much longer. It's much safer to use. It has a wide, stable base, so it's much less likely for anybody to need to put a lot of effort into balancing as well. The other feature of the CUB is it's not really just a support to sit on. It can be used in lots of different ways, and lots of women use it to labour on hands and knees, all fours, leaning over it, or they use it for more upright kneeling or asymmetrical kneeling. It's great for people to provide counter pressure in the lower back or provide massage, and people do birth in those positions using the CUB fairly frequently. There are lots of really beautiful photos on our website that show people using it to give birth in various different positions. There's also a leaflet that comes with the product, and it's got a range of positions on it as well that can help you use it. So what would you be thinking about as a healthcare professional? I know that I would be thinking, well, how easy is it to clean for a start? We provide a hospital cleaning guide. It has been assessed as low risk in terms of the guidelines by the MHRA in the UK in terms of infection control. So very basic decontamination. It doesn't need sterilised any more than a hospital bed needs sterilised, or a stool needs sterilised, or a chair. However, what we recommend is that it's rinsed initially. Any obvious contamination is rinsed off, and then it's dried with some paper towels, and then you can use sporicidal antibacterial spray or wipes. Whatever you use to clean your delivery beds in your unit is safe to use with the CUB. It can also be cleaned with a 10,000 parts per million bleach solution, and a Milton solution can be made up to that effect as well. So you clean off any surface contamination you can see, dry it with paper towels, obviously wearing your personal protective equipment, gloves, aprons, mask if that's what's required in your unit. Once you've dried it off, you then spray or wipe it with your cleaning solution and allow it to air dry before you deflate it and store it away after that. The other things you would be thinking of as a healthcare professional, well, does it interfere with anything that we feel may be necessary? And by that I'm thinking of continuous monitoring. It's very easy to use with continuous monitoring, whether somebody's on the bed or using it on the floor or whatever position you're in. Examinations, you can easily perform vaginal examinations using this with the woman in different positions as well. Really it's about using your own judgment at the time about what it is you need to determine from anything that you're going to do. The other thing to think about with it is the weight limit of this product is 120 kilos, which is about 19.5 stone. So if you have somebody who is bigger than that, then we don't recommend that they use this product. Equally, we need to make sure that people understand it's not to be used by two people at one time either. So somebody sitting on the front and somebody else squeezing themselves on the back is just a big no-no. Don't allow your colleagues or yourself to play with it, kick it around the floor. Don't allow visitors or their children to play with it and move it about anywhere either. It can be used in a single inflation on a hospital bed if you have a person that for whatever reason has an epidural or has other issues going on during their labour that they need to be on the bed, and that does happen. So how do we use the CUB in those situations? It's actually very easy, and in our next short video I'll show you how to do that.